It's an all too common story. People with serious medical needs do not receive care simply because they can't afford it. According to recent studies, 18.1% of the residents under 65 years of age who live in Coleman County are uninsured. That translates to approximately 12,212 people without health care insurance. To help with this tremendous need, area churches along with community leaders began an initiative to meet the health care needs of the uninsured in our community.
Brent Norris, the priest at Grace Church, Episcopal Church across the street, actually had the idea for the clinic. But it was a challenge for our congregation because we're not that big in numbers of people. But from the beginning, after it was discussed at church, we reached out to churches across Coleman. To me, the chapter about the Good Samaritan in Luke struck very much home with me. This is the Samaritan on the road who stops to help people who need help. This clinic is that kind of operation, day in and day out.
The Good Samaritan Clinic offers care for routine illness as well as comprehensive care for patients with chronic conditions. The clinic also offers routine dental exams and extractions, hearing evaluations, and vision care for high-risk individuals. Medicine is another important area of care. The majority of medications are provided at no charge to Good Samaritan's patients. This is made possible through monetary donations, donated medicine from long-term care facilities, and the Patient Assistance Program linking qualified patients to free medicine from numerous pharmaceutical companies.
The patients I've been privileged to see at the Good Samaritan Clinic in general are very appreciative of the care they get. And that's rewarding to me, not just seeing the patients that I see on the occasional time I'm over here, but to realize that they're getting good care through the clinic staff. They're getting as good a care as they would get in my office or any other physician's office, and that's rewarding.
The Good Samaritan Clinic also provides long-term benefits for the community. Gone untreated, many of these chronic health issues worsen, forcing the uninsured to seek care in the hospital's emergency room, creating a tremendous financial burden on the healthcare system. There's a common misconception that everyone will have access to health care insurance through the Affordable Care Act. But according to the National Association of Free and Charitable Clinics, many individuals find themselves in a coverage gap, where their income is too high to qualify for Medicaid, but too low to receive the public subsidies and tax credits necessary for them to purchase insurance on the healthcare marketplace. David is a patient of Good Samaritan who applied for insurance through the Affordable Care Act, but was told he did not make enough money to qualify.
So the Affordable Care Act and the news and everything, didn't have insurance, thought, hey, I can get covered now, but unfortunately didn't make enough to get covered. The people that was supposed to help intended the most, it's just letting slip through the cracks.
The majority of Good Samaritan patients come from a working household but simply cannot afford insurance premiums, deductibles, medications, and the high cost of health care.
I was fortunate to be able to be involved with the beginning of the clinic with Jerry Jacobs 11 years ago. There was a real need at that time for a place for medical care for people who were often working, industrious, hardworking people who did not have health insurance and were not able to afford to go pay cash at a doctor's office.
Carl is a patient of Good Samaritan. He became aware of the clinic through a friend when he started having some health concerns.
I first started coming to the Good Samaritan Clinic when I started getting headaches while I was working as a security guard. I also found out that I had trouble with the cholesterol and diabetes and high blood pressure as well. That was what started the problems with my headaches. Now that I'm coming to the Good Samaritan Clinic, I'm able to get the medications that I need.
Stephen is a relatively new patient to the clinic. He lost his job and much needed health benefits a couple of years ago.
About 2 or 3 years ago, I lost my job. And what I did to live after that point was I lived on my savings and then a COBRA insurance policy that handled all my prescriptions and my medical needs. All of those needs have been taken care of. You know, I get my prescriptions here. You know, I have the care that I need here. The most I've ever had to wait for an appointment has been like 2 days. So it's really been great, and I'm very, very grateful to have the services from Good Samaritan Clinic.
Maria is a cancer survivor and also the sole provider for her home.
I came to here maybe 9 years ago because I'm a survivor of the breast cancer, and my doctors in the regional hospital sent me to this clinic. But I'm working by myself in my home, and I don't have too much money to spend in my medicine and my bills. I don't know, for me it's very, very good, this clinic.
Ben credits Good Samaritan for saving his life. He was a truck driver and ignored symptoms for several months. He was first seen in the hospital ER, and now, after an extensive battle with cancer, hopes to return to work someday.
Well, I was a truck driver, and I was behind the wheel in LaGrange, Georgia, and I passed out. When I came to right before I hit somebody. I called my wife and told her something's wrong because I could not open my mouth hardly. I was hurting really bad. She took me to the emergency room, and that's when I was diagnosed with stage 4 tongue and throat cancer. So I got referred here for the financial assistance to get chemo and radiation assistance. And they helped me get the treatments done, and of course I'm in remission now. I've been in remission now for 3 months.
We strive to provide good quality health care here at Good Samaritan Clinic. I am so grateful to be a part of the Good Samaritan Clinic. We not only offer quality care, but there is continuity of care. I'm able to spend extra time with my patients when they need it.
I wanted to volunteer at the Good Samaritan Health Clinic because I grew up without the blessings that I have now, and to be able to give that back to the community is something that means a lot to me.
I find that the folks who I get to see in my own clinic are of course well cared for, but the level of appreciation that I get from the folks at this clinic is quite a bit different than what I see in my own private clinic. The folks here, they need the care, they know they need the care, and they appreciate what we can do for them here. I also find that the level of involvement from our community allows us to give them the kind of care they need. It's not just a solo effort here at this clinic. It's all of Coleman that really participates in this. And the folks at this clinic know that, and they appreciate what we do.
If I can restore their ability to hear, they may be able to become a functioning member of our community. And that's why I do this.
In the end, it's about improving the quality of life for the patients. Because of the care they receive from Good Samaritan, patients are able to manage their health conditions, allowing many of them to remain employed and to lead productive, satisfying lives. Each and every one of us is a potential patient of the Good Samaritan Clinic. One accident, one illness can bring a family to the edge of financial disaster. That's why the Good Samaritan Health Clinic needs your support to continue this important mission of delivering sustainable, long-term health care and all-around wellness to the uninsured members of our community.